Welcome to the Outdoor Muscle Show, where we talk about strength, endurance, adventure, and everything in between. I'm your host, Buck Stewart, and today I'm talking to Dr. Nick Pippert. Dr. Nick Pippert is a physical therapist, pain coach, and ACE certified personal trainer, specializing in helping hikers eliminate chronic knee and back pain so they can get back to exploring the beautiful trails they love. If you've struggled with pain or injury that prevented you from doing the things you love, you won't want to miss this episode. Now, on to the show. Dr. Nick Pippert, welcome to the show.
Hey, thanks, Buck. It's great to be here. I'm really excited to come on the show and talk with you today.
Yeah, I'm excited too. So I found your account just scrolling through Instagram one day, and I noticed, there's a lot of physical therapy accounts out there, but what I really liked about yours was the focus you have on helping hikers. And as an avid hiker and trail runner myself, I found a lot of the information you were putting out really useful. So I was eager to talk to you and kind of dive into what you do a little bit. So let's just start with telling us a little bit about how you got into physical therapy and why you're now focusing on helping hikers.
Yeah, so pretty common story for PTs is they've had a personal experience with having an injury and then going to rehab and kind of returning, almost like a redemption story. So for me, that was true. In high school, I was a soccer player and I had just a classic knee injury, turf field, molded cleats. You kind of pivot, cut, and then the knee just kind of goes out. And I ended up tearing my ACL. Ligaments are definitely a long rehab process. So I was in PT for a year before I got back to soccer.
Wow.
So ton of exposure, right, to PT. And I was like, this is pretty cool. I
Yeah.
think I might want to help people, get back to doing their things that they love too. So that's kind of how I got into PT. And over time, as I've got out of school, I found that I really enjoy the outdoors. And that's a big thing for me to de-stress and unplug. And so I've just been hiking more and more and more. And as I've come into kind of the business journey, I wanted to help this group of people because I'm in that group and I've experienced some of the things that they've been dealing with. And I know that I can bring a good offer to them and help them out.
Yeah, that's awesome. I think you're exactly right. That's how a lot of people get into physical therapy or training. Like they have that experience when they're younger being around it. And unfortunately, an ACL tear is not a great way to be introduced to it, but it seems like it put you on a great path.
Yeah, I definitely feel like it was sort of meant to be, so to speak, and put me on the path that I needed to be on.
So let's just jump right in. What are some common injuries that you are dealing with as a physical therapist?
Yeah, so in terms of hiking, very common to have front knee pain, and that happens a lot with stepping down. It's honestly quite similar to maybe some of the injuries that your clients and maybe you have run into, like an overloading injury where you just up the mileage too much, or you take on incline a trail that's a little challenging. So that's really common in both the hiking and the running space for us.
Mhm.
And it really is more of an overuse injury. We just do too much too quickly, and that causes the tendon to get irritated and hurt.
Yeah, definitely see that a lot. And I have experienced that myself. Before I got into coaching and really learning about the science behind programming, I did what a lot of people do. I just tried to muscle through everything and I ran as much as I wanted, like whenever I wanted, and it was too much too soon. And sure enough, developed knee pain, shin splints, the usual suspects.
Yeah, I've trained and completed a marathon myself, and I read David Goggins' first book, and I was like, all right, when's the next marathon? Let's go do it. And ended up not knee pain, but I had some pretty bad sciatica from it. So running, like the barrier to entry is so low, like you just get these overuse injuries because people get motivated and they get after it, which is great. It sucks that they have to get an injury.
It's so funny you say that. Like I totally read I can't remember the name of the first book. Is it Never Quit or Never
Can't
something
hurt
like that?
me or something like
Can't Hurt
that.
Me. That's what it was. Yeah. I read that and that was definitely fuel for doing my first marathon. I'm sure a lot of us are in that boat.
Totally.
What are some common prevention strategies then?
The best thing that runners can do, we find this a lot with runners, is lift weights. You
Mhm.
just need to be stronger and be more robust as a human being. And I love the functional movements, squats, deadlifts, step ups, step downs, those things that you're using multiple muscles with in the leg to just hit all the major muscle groups. And we find like, especially with our distance runners, they just like to run. Like that's their exercise of choice. So that's what they do a lot. And it helps to have a little variety. And then on top of that, it helps to strengthen your muscles around the joints that you're using a ton.
Definitely something I push all the time. Strength training for living an adventurous life. Like that's kind of like my tagline. And it really is true. Like it will help you in the long run. Going back to like the knee thing, because now I'm just kind of curious for myself, because I do get some of that dull and knee pain, like when I'm doing, especially long distance hikes, or if I'm carrying like a heavier load. What are some specific things I can do?
So I think the best prevention is getting strong. When
Yeah.
it comes to having like, you actually feel the pain immediately, isometrics are great at calming tissue down and calming the muscle down like immediately.
Mhm.
So when somebody comes in to the clinic with this sort of injury, whether they're a runner or whatever caused it, my go-to is a isometric where you're kicking out into the back of your other leg. So if you can imagine you're sitting with your legs down, you wrap one leg around, and then you just kick back into the back of the other leg, and you hold that for 30 seconds. And we do
Mhm.
a couple rounds of that, and then we retest. Most of the time, what our test is a step down. So you're stepping down, loading that knee, and
Mhm.
they're like, "Oh, that hurts."
Right.
And we do the isometric and then we do the test again and it helps. So if you're on trail, if you're on a hike, on a run, sometimes a kick out or another way to do it would be like just to hold a squat and just hold the position.
Mhm.
That's an isometric for the quad and the front of the leg. And that could calm the tissue down right then and there.
Interesting. So, okay. So basically, like pull over, find a rock, stabilize yourself, and then do this kick out isometric method. And that could actually help decrease the amount of pain you're experiencing while you're on the hike.
The way I educate people about this is our tendons, their fibers are all running kind of lengthwise together,
Hmm.
and they're designed to take load, to take tension. And when they're overused, that's still their designated job is to take tension. Isometrics is the nicest way that we can apply some tension, and that helps them to calm down. It tells our body, oh, yeah, this is okay. I can do this. And it opens the door for us to either continue our hike and continue our run, or opens the door for us to do other rehab things to ultimately address the overuse that's happened.
That's really good to know. You don't hear a lot of people talking about what you can do when the pain is happening.
I, I definitely try to give people some things to help them immediately because if you have less pain, even if it's just less, it's not gone. You're going to move better. You're going to have better range of motion. You're going to be stronger in whatever task that we're asking you to do. So if we can find a way for us to at least minimize the pain that a person is in, it's going to help them across the board.
One of the things I think is difficult for a lot of people to determine is like what kind of pain they're experiencing. And we had talked a little bit about this prior to our call. Can you kind of go over the difference between acute and chronic pain and how people might be able to differentiate between the two?
Great question. And we touched on this a little bit at the beginning. Our runners and our hikers, they're going to have a more acute style pain because I'd have a clear mechanism, a clear reason for why the pain is coming on. And
Mhm.
that is overuse, whether we're taking on an elevation or taking on an additional mileage that we're just not conditioned for yet. That's more of an acute style pain. And it's going to present pretty quickly. Like you
Mhm.
have your reason for why it's coming on, extra mileage, extra elevation, and it's going to happen either right then and there or maybe the next day where you're starting to feel that discomfort.
Mhm.
So acute pain is defined by pain it's happened within the last 2 weeks because that's our inflammatory time frame. Our typical inflammatory response is between 3 and 2 weeks. So if you get a paper cut, it's going to be more on the 3 week mark. If you get more of a bigger injury where you might roll your ankle, That swelling response can last up to 2 weeks, and that's
Mhm.
our acute cutoff point.
Is
Now, there's a
2 weeks, you said?
subacute phase where we're kind of in between acute and chronic.
Mhm.
But chronic is typically defined as pain that's lasted more than 3 months, or it's come on and come off in that time frame. So some people, they might have an acute flare and then they're like, oh crap, I'm going to stop hiking, stop running.
Yeah.
And they go back to it a couple months later and it happens again.
Mhm.
So that's bordering on more of the chronic side where we got this kind of boom and bust cycle.
So I imagine when you're talking to your patients, like you would rather have someone kind of come in at the acute phase than wait until something turns into that chronic pain.
Totally.
Yeah.
And chronic pain is more problematic for a myriad of reasons. One, your body gets better at having pain. It gets better at whatever neural circuitry that we send signals to. So if you have pain over and over and over again, your body is just going to get accustomed to using those pathways, and it's going to
Mhm.
be easier for it to feel pain. On top of that, our chronic pain tends to expand because the body is really trying to get our attention. When it comes to pain, it's an alarm. It's a productive thing that we have in our body. It tells us something's wrong. But when we have it for a long period of time, that alarm gets turned up. The
Yeah.
volume increases, and we feel that volume as an increase in area of our body that's hurting. So maybe your knee pain starts to go down to your shin, as an example, or
Mhm.
your back pain starts to go down the back of your leg, as an example. That is the symptom region getting bigger. And the reason that's problematic when we're treating that is because it gets a lot more muddy about what is the problem area, what is the thing that we're trying to treat.
Mhm.
And sometimes multiple things can be wrong. Like we can have multiple areas that are irritated. Whereas if we take a look at acute pain, we have this 2 week mark, very clear what tissue is irritated, very clear what we ought to do to help, and it makes the client's mind, and it eases their mind. It makes the clinician's job a lot easier. So we have a very clear road to follow.
Mhm. In terms of like rehabilitation and recovery.
Yes.
One of the things I'm becoming curious about as we're talking about this, do you ever see a situation where like some other lifestyle factor is affecting someone's pain, like in their activity that they're doing, whether it's hiking or running or whatever? And I'm thinking about like me, like mostly sitting at a desk all day, how my body is positioned. And then I go out and I try to like run 12 miles or something. And it's like sometimes it feels like, am I just getting older or am I asking too much because my body just went from this really different position to now doing this very active thing?
Yeah, I'm totally in that camp where our lifestyle really impacts our pain. Certainly, like a sedentary job like you and I have, it definitely makes it more difficult to go out and be super active. Standing desks have been big since COVID.
Mhm.
And the reason I like them is because it forces you to be in a variety of positions.
Yeah.
You just can't stand all day in one position. It just doesn't work. You're going to be shifting side to side. For me, I put my leg up on a stool and then I switch sides. That variety of movement affords you, you're not stoved up and tight because of you've been in this one position all day.
Yeah. So, okay, so a standing desk would be something you recommend then.
Totally. And not that sitting is bad, but it's just a different, it's adding variety, right? You want to spend some time standing. You want to spend some time, I call it the Captain Morgan position where you got a
Mhm.
foot up, sitting. So it's just getting more movement variety. And I always tell people we're not really focusing on posture. To have like the military man
Right.
straight up stiff posture is not what we're going for. We
Yeah.
want like the next posture is your best one. You just want to continue to move. That's how we were designed to continue to move.
I really try to make an effort to like just go walk around, whether it's just my immediate area or go outside for like a 10-minute walk, like every 2 hours. And half the time it doesn't work. But if I can at least do that like 2 or 3 times a day, like I do notice I feel better.
Yeah. And I think it's just adding a little bit of extra movement in the day. It's not a shock when you go for your 12-mile run.
Yeah.
Now, you mentioned this sedentary behavior, which I think is huge right now for our on screens all the time.
Mhm.
But I want to also make a point too that other lifestyle factors can play a role too. In fact, I just had a really unfortunate scenario with a client at my full-time job. He lost his younger brother,
Wow.
and he had a flare up with his shoulder pain,
Hmm.
and there was nothing that we did that changed like we didn't try any new exercises. There was no like physical sort of reason for why he was more flared up. It's just his threat level, his threshold for having pain decreased because of this event, and just the normal exercises, his normal day-to-day life was pushing him past the point where he was going to have pain.
That's crazy. I've never heard of that before, but that makes a lot of sense. I mean, that's really sad to hear that, but wow, that's interesting. Do you
Yeah,
see that a lot?
we see it, well, I see it all the time, but we see
Yeah.
it more with more chronic type symptoms because the the same thing we were talking about earlier, as that symptom region expands, people start to have more fear about what's going on. They start to question, do I have cancer? Is something really wrong with my back or my knee? It just creates a lot more fear. And that's another layer that then we have to unpack to lower the threat level and
Hmm.
get these people moving more. Like, we want people to move more, not less, right?
Right.
So when we have high fear, we have a lot of worry about moving. We're not going to move more. We're going to sit more. We're going to worry more and kind of be in a smaller world.
It's interesting you say that, and kind of like what led us to this conversation was like the more screen time and like sedentary thing. It's like I feel like I have more fear the more time I'm on a screen anyway. I'm sure being in the medical field, you're probably dealing with this all the time where people self-diagnose. Because I know I do it. No matter what the symptom is, you will find some type of cancer that like has that symptom associated with it. So you're just coming in like hoping, oh God, I hope I don't have cancer. And maybe it's something completely unrelated. So I imagine in like the modern era, being in the medical field is tough because people are probably always afraid. They went on WebMD or whatever,
Yeah.
and they have their own ideas before they talk to
Yeah, we definitely have to unpack a lot of Dr. Google
you. Yeah.
diagnoses. But I mean, that's part of the assessment process, right? That's why we do a thorough assessment at the beginning. We look for red flag things. There are very clear signs and symptoms for serious things going on in our body, and we look for those. And if we don't find them, we say, "Look, Buck, I don't see anything seriously going on here with the knee. The ligaments look good.
Hmm.
Your strength it's less than your other side, but it's, well within the range of what we can expect. And, I've done all these tests. It seems like everything's fine. We just have this structure that was irritated because of, increased mileage or insert whatever reason that we found."
Right. Yeah. And I imagine that's probably a conversation most people look like they're happy about, right? Like if they come in thinking they have cancer and then you're like, no, you're just running too much. You need to cut the mileage. Like they probably leave like, oh, relieved, I would imagine.
Totally. Except runners are like, wait, I can still run, right?
Yeah. Yeah. That's like the hardest part is sometimes getting people to stop. This has kind of got me thinking about other pain areas like that I've personally experienced and I know some of my clients have experienced as well. The knees are definitely probably number one, but I would say number two is the feet. Do you have
Okay.
any like thoughts on preventing like foot pain or like foot injuries?
From what I've done research on for your exercise, it seems like you do a lot of variety of different surfaces,
Hmm.
and that might require you to have some different gear. So if you're like on a trail, you might want to have a different shoe than if you're on a harder surface like the concrete.
Hmm.
Um, Typically, like general recommendations for me in terms of footwear is I want to see what your foot looks like when you're standing. I have a more flat foot, so my arch kind of caves in towards the middle of my
Hmm.
body. Some people have a really high arch where they kind of set on the outside of their foot. And that brings some like different mechanics to what's going on when you step. A flatter foot tends to absorb force well, simply because it's a little squishier, and a higher arch tends to be very rigid and doesn't absorb force very well.
Hmm.
So we want to kind of prop up our high arch people with a little bit of cushion because their foot doesn't inherently do that.
Hmm.
So an extreme example would be putting a high arch person in a hoka because there's just a pillow on the ground that
Right.
you're impacting when you take a foot strike. But what I really like to wear is a barefoot style shoe
Hmm.
that doesn't have a lot of cushion and creates a good feedback loop when I hit my foot on the floor. Like I can feel what my foot is doing. I've experimented a little bit with Hokas myself, and because I have a little more mobility down there, I just feel like I'm working so hard to stay stationary. And it's like you're standing on a cushion and just trying to balance all day. My foot gets really tired.
Yeah.
So trying to match our footwear with our foot style, and then on top of that, with the exercise that you're doing. So you might want a little more cushion for a trail
Hmm.
because there's rocks and roots and different things that, can push up into the shoe and maybe cause you to roll your ankle.
Yeah.
When we think about our common day footwear, like our classic Nike and Adidas shoes, they're a little more narrow. They always have cushion, and so our feet never work.
Hmm.
We've taken the work out of using our foot. And when you go to a more minimal style shoe that doesn't have the cushion, well, now your foot has to figure out how to cushion it.
Hmm.
And our muscles start to work. And when our muscles get stronger in our foot, it creates more of that arch because that's just what they're designed to do. And
So gear, what else would you recommend?
yeah, I think it would be great if you were a new runner to go into a Fleet Feet store, or if you're an REI person, have somebody look at you, have someone watch you run in your shoes, and just get some feedback on like what's going on, because sometimes you can prop yourself up with footwear more so than you're going to be able to really think about the foot posture and like do it over the course of an 3 hour marathon.
Hmm.
Like you're just not going to be able to do that. So we have this technology. Let's harness it, right?
Hmm. What about for hiking? Like hiking boots are a little different. Like there's so many options for running to like find the right fit for your foot. But like hiking, a lot of people just go on a day hike. It's 2 or 3 miles, but then you get into like dozens of miles of, people going, deep and staying overnight and that type of thing. Like, what are your thoughts on like footwear for hiking?
We've seen kind of a interesting shift. People using more trail runner style shoes
Mm.
rather than boots, I think, than what we've seen before. So, for example, someone might hike in an ultra style trail run shoe because it's lighter. Um, Me personally, that's what I like. I actually have a Zero brand, which is
Oh, yeah, I've seen those.
more minimal than an Ultra, very
Yeah.
minimal arch support. I'm usually doing day hikes, so I'm not going the distance and backpacking all my stuff in and having 30, 40 pounds on my back.
Hmm.
I think I would like a boot probably more for that. But I have I have a kind of a running shoe style Zero, and then a Limbs brand boot that I use more so like when it's rainy or it's wet or it's snowy. I just want a boot to not have stuff being hitting my ankles and stuff
Yeah.
like that. So
Yeah.
in terms of hiking, we're seeing kind of a pretty similar footwear trend to what running is. And but I will say there are people who love the Merrells, who love the gosh, what is the other brand? Anyways, they love like the very classic kind of heavy, bulky hiking boot, hiking shoe style. And it definitely protects your foot, right? You've got
Right.
a really rigid leather and rubber down there where you're kicking rocks and you're just glancing off. So there is a little bit of personal preference with that too. One thing that might be helpful for foot pain is
Uh-huh.
looking at your ankle range of motion.
Okay.
So we want to look above and below. There's no joint below the foot, but above and below each joint to kind of see what's going on. That's
Mhm.
normally what we do in a PT evaluation. And sometimes a stiff ankle can cause foot problems because we're just not getting the appropriate mechanics to go on. A good test for your toes to nose range of motion is to do your thumbs up,
Uh-huh.
put your thumb on the wall, and then your foot is going to be back here, and you're going to drive your knee forward in kind of like a staggered stance position.
Yeah.
And you should be able, without your heel coming up, to get your knee at least to your toes. And that's kind of that thumb up mark. Now, if you're doing squats and lunges and deadlifts and things like that, you probably need more range of motion than just knee to toe.
Hmm.
But that's a good quick test for folks at home to say, are my ankles stiff? And cue into that. If you are stiff, where do you feel like you're stiff? Are you stiff in the front? That usually indicates more like a joint stiffness, or are
Hmm.
you stiff in the back, like the Achilles area? That might indicate that you're stiff because of more of a muscle restriction.
Okay. So, like, I know for a fact, like, my Achilles are stiff. Like, I have horrible range of motion when it comes to my ankles. And maybe it's surprising I don't have more foot pain. What would be like the recommendation for dealing with that?
Yeah. So I do want to reiterate that it's helpful to be mindful of where you feel the tightness
Hmm.
when you're doing this little test, because that'll help you more specifically select an appropriate exercise. I have two favorites. Foam rolling is great for muscles, and it
Hmm.
gives you a quick change in your range of motion. I actually really love lacrosse balls. I like a lot of sensation when I'm foam rolling. It's not for everyone. Very spicy is what I call it, but it gives you a very quick change in your range of motion because we're putting a lot of feedback into that muscle, into that tendon, and we're telling it, hey, it's good. Calm down. Let's get some more range of motion in here. So
Hmm.
if you're feeling it in the back, try some foam rolling. The other thing, if it's more in the front, using a super band, so those thick rogue bands, loop it on something that's not going to move, apply that to the front of your ankle, and you're going to face your body away from the anchor.
Hmm.
And then that same position that we tested with our thumb up position, driving the knee over the toe and just kind of messing around with different angles. Go straight forward to the side, to the outside. And what that's doing is it's sliding the foot bone over the shin bone and creating some like mobilization that I would do with my hands from the band to get those joints, get those bones doing what they're supposed to be doing, sliding and gliding over each other.
Hmm. Is that something you should do like before you go on a hike or a run, or just like at any point, like just do that a couple times a week? Like, how do you integrate that?
Yeah, if you find that you have stiffness, I would definitely recommend doing it as like a warm up to
Hmm.
whatever activity that you're doing. And I want to also put on top of this, because some people are like, foam rolling doesn't really do anything. I agree if you use it in isolation.
Hmm.
We've got to then move through that new available range of motion. So you do these mobilizations, and then you do a lunge position, or you do a squat position where you're utilizing the new range of motion that you have. And that's really important. Where I think where a lot of people go wrong is we think it's just this one exercise that's going to solve everything. Well, it's kind of like a concert or a cocktail of different ingredients that we need to do to maintain our range of motion, maintain the gains that we get from these exercises.
Yeah, that's a great point. Maintaining, yeah, like if you have a good range of motion, like it doesn't mean that you will always have that, right? There's plenty of things we can do that are going to end up limiting it over the long haul. So just having like a maintenance program is probably a good idea. And making it part of your warm up is like it's an easy way to just this is now a habit that I do before I go do my activity.
Totally. And you can feel a little more confident thinking, I've got more range of motion. I'm at less risk for injury because of it.
Yeah, definitely. Yeah, that's great. I'm getting all kinds of great advice from you, man. I got like a whole routine I'm like working out in my head as we talk.
This is awesome.
Like what's something that could be like causing an issue that like it's not your knee, it's not necessarily like your foot or your ankle. Like what do you see people come in with like maybe they don't realize like it's being caused by their activity like hiking or running?
Yeah. We see hip and back as kind of like silent contributors or maybe even root causes to sometimes. Our sciatic nerve branches at the back of the knee. So you have a nerve that runs like where you typically hurt your ankle when you roll it on the outside.
Mhm.
So sometimes people have back pain, but it presents on the outside of their ankle. And it's just because that sciatic nerve is irritated.
Hmm.
And what we can do is calm that nerve down with specific movements. And the specific movement for the sciatic nerve is like a kick out. So you you're sitting on some sort of seat, you kick your knee forward, and then you bring your toe down like you're pushing the gas pedal. So what that does is it slides the sciatic nerve through the body
Mhm.
and then back up towards the spine. And it's like I explain it like a flossing. So like floss through teeth, you're flossing that sciatic nerve down the leg and up the leg. It is not a stretch. Nerves do not like to be stretched.
Yeah.
And that allows the nerve to calm down. And on top of that, once we've calmed it down, then the next best thing for nerves is cardio.
Hmm.
They love blood flow. So if we can get some blood flow to those nerves, they're going to calm down even more. And that will be that symptom improvement that we had won't be, maybe 30 minutes to an hour. It can be 5, 6, 7, 8, 12 hours of relief because we've got some other things on board rather than just the local movement going on.
That's so interesting. And that's exactly like the answer I was looking for because I never, I mean, who would think of that? Like, unless you're you, like,
Totally.
you probably have no idea that that could be connected, a pain, your back to your ankle like that. Okay, that's a good one. So you mentioned hips as well.
Yeah. So the back of the hips are usually tight for our runners and for our hikers. For a variety of reasons, but I think a chief one is that if they're not lifting, they're tight because they're weak.
Hmm.
So another thing we can do is strengthen those areas. The sciatic nerve can get irritated at the external rotators rather than at the back. And that can cause the same symptom that we were talking about just before this, where you're having symptoms at your ankle.
That's
So
interesting. So, like, it seems like the ankle is like tied into a lot of this,
it is, yeah, because that's the first thing that hits the ground.
right?
And, it's a very dynamic joint. We have the heel bone joint kind of goes side to side, and then the normal ankle joint goes forward and back. So there's a lot of degrees of freedom in the foot that can change how forces move up and down the leg.
Yeah. What about what about the upper body? Do you like is there some weird like you ever see like shoulder injuries that maybe are not injuries but like pain that's like completely unrelated necessarily to what's going on in the shoulder? Like the reason I bring that up is you see like there's like a lot of runners that have like a really big like rotation as they stride. And then I've noticed those are also often the same people that have like upper back pain, for example. Is there anything with the upper body that might be kind of similar to what you described with the lower back and the hips?
Potentially the upper back could be stiff, causing you to like rotate more through your lower back. The low back is actually pretty mobile compared to the upper back because the ribs attached there. And I think that also might be why the upper back becomes stiff. If we are having to use our inhale and exhale muscles a lot and they're getting fatigued, they will stiffen up. And if they're stiff, then by proxy, because of how close the ribs are to the upper back, that can create some stiffness there too.
Mhm.
So I wonder if that has anything to do with how people have this big movement when they rotate. It's because they're just not getting it through their trunk, through their upper torso.
Yeah, I think a lot of that could be like fixed with some minor form cues and stuff too before it becomes an issue. But sometimes by the time someone comes to me for coaching or comes to you for pain, like they've been doing it like that for so long, it's like it's hard to correct it. In the same vein, I've seen a lot of people when they run, they get really fatigued and they start doing this and their
Yeah.
head's just like on a swivel and they're just like, every step and of course I'm sure you've seen this before and they come in, they have neck pain, right? It's like
Yeah.
yeah,
There are a couple different referral patterns, and for those of you that don't know, I don't mean to be used too much terminology, but a referral pattern is like a structure that is irritated. It sends their symptoms somewhere else.
hmm
So commonly, like when we have a rotator cuff tendinopathy, people will say, "Yeah, it hurts right here." And they make this like C grip, C sign around their shoulder.
yeah,
And there's not really a structure that makes that band shape around your shoulder. We've got a myriad of muscles up here and nerves that are going down the arm. But when somebody says, "Oh yeah, C sign," I'm thinking rotator cuff in the back.
hmm
And there are other assessments that we can do to ensure that that's what's going on. On top of that, you mentioned neck pain. Just like the sciatic nerve in the low back, the the median nerve is pretty common, like the carpal tunnel nerve, to even wrist pain, but like just having symptoms go down into your forearm. That's
hmm
oftentimes, unless you're like a racket player or a hockey player, oftentimes that can be referring from the neck down the arm.
hmm So it seems like it's going often like from above to lower in a lot of these cases.
Yes, absolutely right. Good observation. Most of the time, a higher up structure refers down an extremity.
One of the things I wanted to ask you about before I forget, you mentioned the lacrosse balls, which I've heard before, but maybe not everyone has. Is there any other kind of like tools that maybe people, aren't aware of that could actually help them with some of this stuff?
Yeah, I really like the super bands. So lacrosse ball or foam roller, I'll
hmm
put those in the same category. That's probably my number one. I really like muscle work, and that seems to help me a lot. So that's my top one. Super band, which is those big, thick Rogue bands. These are not the flat TheraBands that
Mm,
we give patients to do their shoulder exercises and to do their ankle exercises. These are
yeah.
big bands that will support your weight. And we use these for mobilizing the ankle that we talked about earlier and the hip as well. So hitting the joint as well as the muscle helps to have an additional tool in your toolbox to work on just changing the scenario that's going on in your body. A pillow to like kneel on the floor or a yoga mat is helpful if you've got like vinyl or wood floors. And then the other thing that I've been using more often is a slider. So you can even think of like a furniture mover.
Yeah.
And I really like the kind of like the splits position with the slider. We don't do a whole lot of adductor work in the groin muscles, and I find that mine are super tight. So I work kind of this split position and then try to pull it back towards the midline to just get some load through there because we just don't use them very often.
That's great. And that's all like pretty affordable stuff.
Yeah.
So before we wrap up today, one of the things I wanted to go over for people that maybe have never worked with a physical therapist in the past is what is the experience like, whether in person or remotely? Like, how does it work if you are a patient of physical therapy?
Yeah, great question. If you're gonna do like an insurance-based traditional PT, it depends on your state to require what you need. But most of the time, clinics are gonna ask you to have a referral from a medical doctor. And that's the start of the process. Once you get that piece of paper that says foot pain or hip pain or back pain, you can call a local physical therapy clinic and they will schedule you for an initial evaluation. And that's the first time that you're going to go in. They might have some paperwork for you to do ahead of time, different outcome measures that we want to see. How are daily tasks going, rated on a scale from 0 to 5? The first time that you enter the clinic, you're going to be there for your initial evaluation. And that's when you're going to meet your therapist. They're going to talk to you first. They're going to do an exam and say, hey, Buck, what is going on with the foot? Tell me when it hurts. What does it feel like? They're just going to gather a ton of information by just your report. And then based on what you tell the therapist, they're going to change their exam and look at, okay, well, I think your foot pain is actually more coming from your back. So they're going to look at your back. Or maybe they think it's coming from your ankle and they're going to assess the range of motion, the strength, just different things that are going on at that joint. And that information is then used to decide what exercises are we going to do to help you and what exercises are we going to do to help you get back to running more specifically. We try to make it very specific to what you're trying to get back to. And that's our goal, is to help you get back to exercise or get back to daily task or whatever it is that you're trying to get back to in the simplest, easiest way. And over time, you will get some exercises for home, and then you'll also return to the clinic for follow-ups. Most of the time, it's 2 to 3 times a week to get some maybe hands-on manual therapy. You can get progressing your exercises as we get better. And so there's this kind of follow up, reassess pattern that goes on with the therapy as we get further along in the process.
Yeah, that's great. I've gone through numerous serious injuries myself, and I've worked with a couple different physical therapists along the way, and I've always had a great experience. I've always been super happy that I went that route instead of other options like, sometimes you can't avoid surgery, but if you can, physical therapy is like a great way to do it. And I'm a huge advocate for what you do. So Nick, this has been a great conversation. I've learned a ton from you in the amount of time we've had to talk here, and you've actually shaped a lot of the things that I'm going to do after this call to hopefully prevent some of the injuries and issues that we've talked about. Where can people go to learn more about you and what you do?
I'm so glad that you got so much good information, Buck. I know you're going to share it with your clients. Obviously, if they have any questions, they can find me on Instagram at dr.nickpippert. I do have a website. It is nickpippert.com. My rehab offer, I make content daily about different exercises, some of our chronic pain concepts that we talked about today. So if somebody is interested in having pain, I do work with clients online, and same thing that we start with in a in-person clinic. We do an assessment. What I do is we do a virtual Zoom video chat, and I'll have you do some of these home assessments like we talked about with the thumb, for an example. And that helps us know what we need to do to address any pain that's going on. We do some sort of modification to the lifestyle. If it's running, for example, we might lower the mileage until we can get the structure to calm down, as an example of a modification. And then at that first day, I'm going to give you some exercises that I think are going to help your pain, give you some rehab. That's kind of the hallmark of what we offer, is getting you the exercises that are going to calm the tissue down and build you back up to doing running or whatever exercise that you're trying to do. And the transition from there is strengthening. We're back to square one. We got to get stronger, especially as runners. We got to get our muscles doing things that we need to do in terms of the functional strength that we want. There is a little bit of mindset piece woven throughout. Pain is very fear-inducing, and sometimes we need to unpack that a little bit. So I also coach people on that element as well.
We hated on screens a little bit at one point in this conversation, but because of our modern era, you can now work with someone like Nick from the comfort of your home. So I think that's great. I hope people take you up on that offer, and we're going to link it in the description. So if you'd like to work with Nick, you can find the link below. Dr. Nick Pippert, thanks for coming on the show.
Thanks, Buck. Really appreciate you having me.
My guest today was Dr. Nick Pippert, and you can follow him on Instagram at dr.nickpippert. Nick is offering a 10% discount for his remote paying coaching program to listeners of the Outdoor Muscle Show. Schedule a consult with Nick via the link below and mention Outdoor Muscle during your call. If you're looking for custom strength and endurance programming to conquer your next big goal, make sure to check out the coaching link below. Thank you for watching and listening, and I'll see you in the next one.